we want to go over, we'll just go over basic anatomy, so the structure of the spine. We'll look at the systems of stability. So there's a few different ways to look at that. You've got ligaments that control joint structures. Ligaments are very passive restraints that you can't tell a ligament to control a joint. You don't have voluntary control over that. The active system does, your muscular system. So there's different restraints. Some of them are passive, some of them are active and more dynamic in nature. So we'll talk about both of those and how they can affect one's potential for low back pain. And then we'll talk about some of the more common problems that you might see, that we see in the clinic, and different ways that those problems are managed. Okay. This was Sean's idea this morning. So, I think that the point here is that you can have low back pain regardless of who you are. It doesn't matter how fit you are, and we see some of the most fit people we've ever treated in the world in the clinic, but they have low back pain. Okay? And there are certain factors that make one more susceptible to developing low back pain in terms of their job, how happy they are in life. People who are more depressed tend to have a greater likelihood of having low back pain. So job description, whether you're sitting, vibratory type forces tend to affect one's ability to have low back pain. If you're sitting and driving a lot, jackhammer workers, all these people that have these types of smokers, all of these are factors that make you more susceptible to low back pain. And the things that we'll go over, we'll look at the bones, the vertebrae that make up the spine, the ligaments that we talked about, the tendons. Remember, tendons attach muscles to bones, okay? Ligaments go from bone to bone, whereas tendons go from bone to muscle and then to bone. Okay? And then we'll talk about the nerves, which a lot of people talk about sciatica and that type of problem, and that's a nerve problem, but it's probably overutilized as a diagnosis in terms of how people describe having low back pain. And we'll talk about how to differentiate that. So just to review, the neck portion, so when people think about the neck, that's your cervical spine. The thoracic area is more where your ribs come in and attach. So there are 7 cervical vertebrae, there are 12 thoracic and 5 lumbar, and then you've got your sacrum, which is more this kind of half oval shaped bone at the bottom, and there are projections of nerves that come out of that area as well. The cervical spine, we're not going to talk about as much when we talk about low back pain, but you tend to have that problems in that area more related to whiplash injuries, postural problems. The thoracic spine problems, this is probably the stiffest area of the spine just inherently. There's so many ligaments that come in and attach to that area that you don't have that much mobility in that area, and it's normal to not have that much mobility in that area. And then your lumbar spine, that's where we're going to be focusing today's discussion on. 5 vertebrae, and then we'll talk about some of the specifics of the anatomy in that area as we go forward. Okay. So, on that, if you go back to that, I want to show real quick. So you can't really see very well here, but it's more brownish, I guess, in color here. Those are the vertebrae, and in between each one of those is a little disc. And everybody's heard about discs and how discs get slipped or herniated. There's all different terms that people use. But just to give you a big picture perspective, where are these discs that we're about to talk about? They're located in between each one of these vertebrae. Okay? So the discs look more like this. So this looks more like a lumbar spine facet joint area here. So this is what we call the body of the vertebrae. These are the bones that make up the lower back area. This structure right in the middle is the disc. The disc's main job is to provide, number 1, shock absorption, and number 2, stability. So it almost acts like a ligament. It holds the bones together. Okay. The first property that it gives us with shock absorption is related to the fluid nature of the structure. So normally we have water in that disc, and that water content allows us to bend and move. And typically, people who are in their 30s or 40s are more likely to have these disc-type problems that you hear about. When people say, "Oh, I've got a herniated disc," and they're in their 60s or 70s, it's probably not that's actually causing the problem. That's not to say that you couldn't have a dehydrated part of that disc that has been kind of squeezed off, if you will, and gone into this little space where you see the nerve living. But for the most part, herniations or problems where people rupture a disc, that you usually have to be a younger person for that to happen.
Why is that?
That's mainly because of the content of the water that we mentioned. Your body produces little chemicals within the disc that bind water molecules to it. So it's not as if we're not drinking enough water as we get older. It's more that we just don't produce enough of those chemicals that bind the water to that chemical within the disc to keep it fluid in nature. So it's one of those unfortunate changes that occur with life. We just don't make enough of those chemicals that bind water. And as a result, this disc height that you see here starts to get closer together. And when that gets closer together, you start to see some of these other problems that we talked about. But you can start to imagine then what could happen. You get structures closer together, they start putting pressure on nerves, and that can affect this area, it can affect some of these joints that we'll talk about in a little bit as well.